Good morning. I'm John Sanesteven, President of CHAMPS and President and Chief Executive Officer of Salute Family Health in Fort Lupton, Colorado. Welcome to the virtual 2025 CHAMPS Award ceremony, and thank you for joining us. For over 30 years, CHAMPS, your Region 8 Primary Care Association, has utilized these annual awards to recognize inspiring and outstanding staff and board members from health centers and related organizations across the 6 states of Region 8: Colorado, Montana, North Dakota, South Dakota, Utah, and Wyoming. Our goal is to acknowledge exceptional contributions to the health center community and celebrate highly deserving individuals for their advocacy, leadership, and dedication to community health centers' mission. As a reminder, please mute yourself during the ceremony, and if all possible, turn on your video camera so we can celebrate together. With that, I'll turn this over to Julie Holstein, the CEO of CHAMPS.
Thank you, John. Again, my name is Julie Holstein, and I am the Executive Director of CHAMPS. I'd like to echo John's welcome. It is wonderful to see you all. We are so pleased to be able to honor the work of your phenomenal friends and colleagues with a ceremony to celebrate them. It is truly a privilege to work on your behalf, and CHAMPS remains in steadfast support of Region 8 community health centers and extends enormous gratitude to you all for the amazing work you do on behalf of your patients and communities. Your selfless and exacting efforts to ensure the well-being of those you serve is inspiring. Members of the CHAMPS Executive Committee will be presenting each of our awards, and then each awardee will have a chance to make a brief statement. I will now ask CHAMPS Secretary Colette Mild to introduce CHAMPS' first awardee. Thank you, Colette.
Good morning, everyone. My name is Colette Mild. I am the CFO at One Health and serve as the CHAMPS Board Secretary. Today's first award is going to be the CHAMPS Emerging Star Award, which is intended to recognize an outstanding up-and-coming staff member whose exceptional promise, dedication, and work have significantly enriched a health center and its outcomes, or have advanced the mission and goals of the community health center movement. It is my pleasure to present the 2025 CHAMPS Emerging Star Award to Marissa Borchard, Chief Dental Director at River Valley Family Health Centers in Colorado. Dr. Marissa Borchard joined River Valley Family Health Centers in 2022 to serve the oral health needs of rural Western Colorado. In the past year, she was promoted from dentist to Chief Dental Director, reflecting her dedication to high-quality care, strong leadership, and commitment to the community health center mission. Dr. Borchard strengthened River Valley's dental team by hiring a dentist, a dental hygienist, and a dental assistant while maintaining exceptional team retention. She also partnered with the University of Colorado School of Dental Medicine to host River Valley's first dental student, helping to grow the clinic's workforce and support the development of future CHC dental providers. Dr. Borchard actively fosters collaboration among CHC dental leaders across Colorado, particularly on the Western Slope. These connections have enhanced her peer support and inspired innovative strategies to improve patient care regionally. In her role as dental director, Dr. Borchard expanded her leadership responsibilities while continuing to care for patients. She implemented consistent policies and procedures across clinics to ensure quality and efficiency. A colleague noted, Marissa's greatest leadership strength is leading by example. She is amazing at this, always setting an excellent example. She also encourages those around her and has a quiet, natural leadership style. When community water fluoridation in Hotchkiss, Colorado was at risk, Dr. Borchard joined other River Valley providers at a city council meeting to advocate for its benefits. Their testimony contributed to the town's decision to continue fluoridation. Not only does Dr. Borchard provide excellent clinical care, but she also goes above and beyond to promote health and well-being throughout the community. Dr. Borchard is deeply committed to providing exceptional dental care to every patient. She recognizes the importance of making healthcare accessible and ensuring it is delivered with cultural humility and respect. For her outstanding contributions to advancing high-quality dental care and strengthening the CHC workforce, we are pleased to present Dr. Marissa Borchard with the CHAMPS Emerging Star Award.
Thank you, Champ, so much for this award. I'm truly honored to be recognized as an emerging star. I still remember as a junior in high school, I was eating a Christmas cookie when I heard this loud crack. At that moment, I noticed my front tooth had snapped in half. I remember how all my friends on my locker wrote, "All I want for Christmas is my one front tooth." And I also remember how absolutely mortified I was. I refused to go to school until I was able to get that tooth fixed. Lucky for me, I lived in an area where access to care was not as much of a challenge, and I was able to see a dentist the next day. But those living in rural areas can really struggle. And so that moment is what gives me the drive to come to work each day and show up for my team and for my patients. But that being said, passion when it's just yourself can result in burnout. And that's where I am so lucky to work with an amazing team at River Valley that supports my goals to help our community dental department grow. This award might have my name on it, but in reality, it reflects the energy, the dedication, and the heart of our young and growing River Valley team. From our dental providers to our dental assistants, our front desk, and our leadership team, everyone cares so deeply about this mission. And that kind of passion together is what makes it easy to stay motivated and keep giving your best each day. Now, what makes our team really special too is that while we all work incredibly hard, we also know the importance of joy and fun. Whether it's sharing a laugh between patients or celebrating the small wins, like convincing a patient to start brushing their teeth for the first time. That spirit is what keeps us energized and connected. And it also reminds us that caring for our community also involves caring for each other. Thank you again so much for this award. I look forward to keep working hard, having fun, and providing access to high quality care here on the Western Slope. So thank you.
Thank you, Dr. Burchard, and congrats to you and your team. Our next award I will also be presenting. It is our, excuse me. We're here. It is our only organizational award, the CHAMPS Excellence in Innovation Award. This recognition is intended to honor a health center which showcases innovation, effectiveness, creativity, and adaptability in addressing needs within the organization or the broader community it serves. It is my pleasure to present the 2025 CHAMPS Excellence in Innovation Award to the Scrubs Camp program at Coal Country Community Health Centers in North Dakota. Through its immersive Scrubs Camp, now in its 10th year, Coal Country Community Health Center is transforming how 8th grade students in rural areas explore careers in healthcare. Since its inception, this event has served more than 1,400 students from Balua, Center Stanton, Hazen, and Killdeer school districts. Communities CCCHC has proudly served since 2003. What sets this initiative apart is not simply the act of hosting a career exploration event, but the thoughtful, hands-on structure that Coal Country has developed. The Scrubs Camp is designed to introduce students to the vast and exciting world of healthcare careers through interactive demonstrations, engaging workshops, and real-world activities. Through strong partnerships with the local critical access hospital, long-term care facility, county ambulance service, 4 school districts, community healthcare associations of the Dakotas, and more than 60 dedicated staff, CCCHC has built a collaborative model that fully immerses students in a realistic healthcare environment. Camp participants rotate through eight distinct healthcare disciplines, including behavioral health, dental care diagnostic services, emergency medical services, long-term care, nursing, rehabilitation services, and surgical services. In each rotation, students engage in tasks such as suturing a pig foot, practicing CPR on mannequins, exploring a cow heart, and other skill-based activities, while learning about career paths and the skills necessary to succeed in the healthcare industry. This hands-on experience not only informs, but inspires and empowers students to imagine futures in healthcare and recognize the meaningful impact they could have. CCCHC Scrubs Camps is more than just a career day. It is a transformative experience that sparks curiosity, builds confidence, and encourages students to pursue futures in healthcare. It is a shining example of the innovation in action, shaping the workforce of tomorrow by investing in students today. for its outstanding commitment and visionary approach to fostering the future healthcare workforce, we're pleased to present Cole Country Community Health Center with the CHAMPS Excellence in Innovation Award. Congratulations to the program, and I understand that Kara Pulver, Director of Marketing, will be accepting the award on behalf of Cole Country Community Health Center. Please feel free to offer your remarks, Kara, if you are available.
Yes. Hello, everyone. My name is Kara Pulver, and I'm the Director of Marketing at Cole Country Community Health Center in North Dakota. I serve as the coordinator of Scrubs Camp, but this program involves many of our staff. So I'm honored to accept this on behalf of our entire team. Thank you, Champs, and a special thank you to Shelly from CHAD for nominating Cole Country and our Scrubs Camp program. As I've shared, Scrubs Camp is truly a team effort. It takes many of our staff, along with our local healthcare partners, to make it happen each year. Our staff show up excited, have a great time with the students, and love sharing what they do, along with the schooling and training that got them there. Since we started, more than 1,400 eighth graders have participated, and watching their excitement in exploring healthcare has been incredibly rewarding. We're proud to help shape the future workforce right here in our rural communities, growing our own and hoping they someday return to care for the communities that raise them. Thank you again for this recognition. It means a lot to our whole team, and we look forward to continuing this work and inspiring the next generation of healthcare professionals. Thank you.
Thank you, Karen. Congratulations again to Cole Country. My name is Chastity Dahlbeck. I'm the Director of Patient Care and Innovation at Cole Country Community Health Center. I'm the current chair of the CHAMPS Mountain Plains Clinical Network Steering Committee, and I serve as the clinical representative for the CHAMPS Executive Committee as well. So today I'm pleased to present the CHAMPS Exceptional Administrative Leadership Award, which recognizes an individual who demonstrates innovative and effective strategies that strengthen their health center and community. It is my pleasure to present the 2025 CHAMPS Exceptional Administrative Leadership Award to Tim Trithart, Chief Executive Officer at Complete Health in South Dakota. Tim has been with Complete Health for over 15 years, and throughout his tenure, he has consistently guided the organization in a positive direction, nurturing both growth and stability through quiet strength and intentional leadership. He leads with a calm, steady presence, always listening intently and asking insightful, thought-provoking questions. His approach models an attentive kind of leadership that values observation and reflection before action. This philosophy has left a lasting impact on those around him, shaping the way others lead and collaborate. Tim supports innovation and champions creative thinking, calculated risk-taking, and the exploration of new ways to improve operations. He welcomes new ideas and empowers others to challenge the status quo, creating an environment where people feel safe to speak up, try new approaches, and grow professionally. Even in times of significant stress, particularly in today's complex and ever-changing FQHC landscape, Tim remains composed and focused. His ability to shoulder the weight of leadership without burdening others is a testament to his character. Through every challenge, he remains approachable and grounded, offering reassurance and stability to his team. Tim also brings warmth and humanity to his leadership. He knows how to lift others up when morale is low and has a natural ability to bring a smile to your face, even in difficult times. His pie baking skills are well known, as he brings a homemade pie to each staff meeting and raffles it off to one lucky team member. His common sense approach to both life and work creates an atmosphere of trust, collaboration, and respect. In every sense, Tim exemplifies what exceptional administrative leadership should look like, with visionary thinking, quiet strength, and unwavering support of his team, and steady guidance through both calm and storm. In recognition of his thoughtful leadership that fosters trust, innovation, and collaboration, we are pleased to present Tim with the CHAMPS Exceptional Administrative Leadership Award. Congratulations, Tim. You are welcome to make a few remarks and come off mute.
Thank you, Chastity. Thank you to CHAMPS and everybody. Thank my board, thank my staff. Obviously, you get anything like this, it's really a testament to all my staff because they're the ones who make me look competent when we all know that I'm really not that competent. So when I was like 8 or 9 years old, my father pulled me aside and he asked me what I wanted to be when I grew up. And I told him I really hadn't decided, and I was, wavering whether I wanted to be a firefighter or a pilot, maybe an astronaut, maybe play drums for Van Halen. But you guys all know I was lying. Even back then, I knew I wanted to lead an FQHC. I wanted to memorize acronyms. I wanted to argue with Medicaid about PPS rates. I wanted to deal with OSVs every few years, live that sexy dream that we all live here. So, and you guys all know that, over the last 15 years that I've been here, I've gotten to do all that. It's been great. But even more, I've loved the people that I work with, the people that share this mission of ours, that doing impossible things every day, how we stretch every dollar like it's taffy. Uh, those of us that understand equity isn't something that's just abstract, that we care for everybody who walks through our doors like their family. So thank you. Any leadership award like this, like I said, it's a team award, and I've been privileged, blessed to work with some of the best people that I've met in my life. So, and yeah, my dad, he's long gone. He didn't get the chance to see me in this role. I think he knew that I wasn't going to be the drummer for Van Halen. But I think, and I'm sure if I had, I'm sure they're nice fellows. I would have liked working with them as well. But really, honestly, the people that I work with in this movement are the best. So, because what we do in community health care is amazing. So thank you, all of you.
Congratulations, Tim. So well deserved. My name is Maria Clemens, and I serve as the Executive Director of the Northwest Community Health Center in Montana. I'm also the current CHAMPS Board Vice President. I'm happy to present the CHAMPS Exceptional Board Leadership Award today, which is bestowed upon a Health Center Board of Directors member who exemplifies dedication to and excellence within community-led governance. It is my pleasure to present the 2025 CHAMPS Exceptional Board Leadership Award to Jim Morton, Board Chair at Sapphire Community Health Center in Montana. Nearly 12 years ago, Jim Morton recognized a significant need in Ravalli County, particularly in Hamilton, Montana, for a primary care clinic that would provide both primary and behavioral health services to underserved and uninsured residents. Driven by this vision, Jim dedicated countless hours to researching every possible path to make this a reality. When it was suggested that he apply to the Health Resources and Services Administration to establish a new access point, he took on the challenge. The application process was extensive, requiring more than 150 pages of documentation, including a detailed budget and business plan, letters of support from community leaders, comprehensive demographic data on the local population, and an assessment of existing providers in the area offering similar services. With the support of future board members, Jim gathered and submitted all required documentation. Although the initial application was denied, he remained undeterred. After 2 more attempts, HRSA approved the 3rd submission, officially designating Sapphire Community Health Incorporated as a new access point in 2015. In accordance with HRSA requirements, Jim also led the effort to establish a board of directors composed of at least 9 community members who live and work in the service area, and at least 51% of whom are patients of the clinic. Through Jim's leadership, every requirement was met, and the journey to bring accessible healthcare to the community began. The project required an extraordinary amount of work, including countless meetings, hours of research, and a deep understanding of the federal application process. Thanks to Jim's vision and persistence, the much-needed primary care clinic now serves more than 4,500 patients annually. In line with his original vision of integrated care, Sapphire also launched a behavioral health program, which was formally recognized by HRSA in 2023 and serves more than 1,800 patients each year. For his visionary leadership and unwavering dedication to expanding access to care, we are pleased to present Jim Morton with the CHAMPS Exceptional Board Leadership Award. Congratulations, Jim. Please come off mute if you would like to offer a few remarks.
Well, yes, thank you. This is quite an honor, especially coming from colleagues, folks who know about community health centers. I think Our organization, like many FQHCs, had its starts and stops, but what drove us was the understanding of the need. We see our fellow residents who do not receive primary health care. We run into small businesses who can't afford the health insurance for their staff. So that was a big driver in the members of our board who kept applying, and then the overwhelming support from the community. As mentioned, we finally received the grant, and then started the hard work of hiring staff. And thank you to our current CEO, Patrick Peer, who has been leading us for the last couple of years. But I really want to mention our state association, the National Association. What really impressed me was no matter what I needed, I could call our state association or another FQHC, and they always welcomed me. They always said, "What can we do to help you with your application? What can we do to make you successful?" It wasn't that they were going to covet anything they had, whether it's their bylaws or anecdotal information. And I think that, along with this idea that we are a center, not just a clinic, we're a health center. We want to provide behavioral health, we want to provide dental, we want to provide all those wraparound services in a holistic way. And I think that sets us apart, not only because we are targeting some of the most vulnerable folks in our communities, but because we have this longer term and wider vision of individuals who we see every day in our communities. So thank you, Champs, and thank you for the nomination. And I'm really pleased to serve with all of you. Thank you.
Congratulations, Jim. It is now my honor to present the CHAMPS Exceptional Clinical Leadership Award, designed to recognize a medical, dental, behavioral health, or other clinical staff member who displays outstanding service and commitment to improving the health and well-being of their patients and community. It is my pleasure to present the 2025 CHAMPS Exceptional Clinical Leadership Award to Linnell Huseby, Director of Clinical Services at Family Healthcare in North Dakota. Linnell has been an integral part of family healthcare for over 25 years, serving in a variety of nursing and leadership roles. In her current role as Director of Clinical Services, she plays a vital part in both the day-to-day operations and long-term success of family healthcare's clinical teams, supporting the nursing, medical, and laboratory departments. Her ability to anticipate needs and proactively address them helps the clinic run smoothly and efficiently. While much of her work happens behind the scenes, her contributions are essential to the organization's success. These include optimizing the electronic medical record system, updating policies, managing schedules, approving timesheets, coordinating with vendors, and supporting department managers. Linnell exemplifies what it means to be a collaborative leader. She works seamlessly across departments and with all levels of leadership, always ready to step in where needed and bridge operational gaps. Her approach to problem solving and calm, supportive presence have earned her the trust and respect of colleagues throughout the organization. What truly sets Linnell apart is her deep commitment to the mission of family healthcare. She is passionate about improving the lives of the patients served and supporting the teams who care for them. Her longevity and lasting impact speak volumes about her character and leadership. Family healthcare simply would not be the same without her. We are pleased to present Linnell Huseby with the CHAMPS Exceptional Clinical Leadership Award in recognition of her devotion to family healthcare's mission, patients, and care teams. Congratulations, Linnell. We welcome you to come off mute and to offer some remarks.
Thank you so much. So receiving the Clinical Leadership Award from CHAMPS, it's an honor and it means a great deal to me. But not just to me, to everyone at Family Healthcare in Fargo. We do this work because our patients deserve unwavering, high-quality care, regardless of their circumstances. And this recognition affirms that commitment. In our region, FQHCs carry a heavy load. We serve the people who often fall through the cracks, and we do it with limited resources and a lot of determination. This award shines a light on that impact and that mission-driven care that we have for healthier families, stronger communities, and a system that actually works for the people who rely on us most. It's really a team effort. I've had the opportunity to work with some incredible leaders and learn from each of them in developing my own leadership skills. I am incredibly proud of our team, the clinicians, support staff, partners who show up every day with compassion and resilience. This recognition belongs to all of them. Thank you, CHAMPS, for the acknowledgement and for championing the work FQHCs do across the Mountain Plains region. We'll keep pushing forward.
All right, congratulations. And again, this is John Santa Stephen, and today I'm happy to present the CHAMPS Outstanding Advocate of the Underserved Award, which over the years has allowed us to acknowledge those who champion the population served by Region 8 health centers, going above and beyond to increase access and improve health outcomes. It is my pleasure to present the 2025 CHAMPS Outstanding Advocate of the Underserved Award to Adesali Calderon, Immigration and Refugees Center Director at Sunrise Community Health Center in Colorado. Adesali Calderon's journey from an indigenous village in, hopefully I say this correctly, Michoacan, Mexico, to becoming a respected leader in Northern Colorado is a powerful testament to her reliance, vision, and lifelong commitment to community advocacy. At 17 years old, she left her hometown to pursue a degree in philosophy supported by a scholarship earned through grassroots activism. The formative experience shaped her values and ignited a passion for organizing and serving unrepresentative communities. Since arriving in Colorado 16 years ago, she has continued this work, bridging immigrant families with their virtual resources and empowering both individuals and institutions to collaborate for lasting change. As director of Sunrise's Immigration and Refugee Center, Adesali has more than doubled the organization's reach. Her leadership is grounded in three guiding principles: meeting client needs, maintaining fiscal responsibility, and fostering inclusive decision-making. She is a facilitator, a connector, and a trusted voice, especially in times of uncertainty. Her career spans decades of services from Mexico and the United States, including her work as an educational specialist with the Secretary of Culture in Michoacan. Adesali's unwavering dedication, culture, insight, collaboration spirit make her not only an extraordinary advocate, but a beacon of hope for the community she serves. Yeah, congratulations, and it is my pleasure to present this award to you. And if you'd like to say a few comments, feel welcome.
Thank you, John. I really want to say thank you for CHAMPS, that I didn't expect this recognition, and I feel very humble. And first of all, I would like to say thank you to my team, Sunrise Community Health, and the Immigrant and Refugee Center. I couldn't ask for more than this beautiful team. I really appreciate Brian, who nominated me, and I know I really appreciate. And I gonna say that something that it really shaped my values was when I was a child. I grew up in a small village in Michoacan, and I grew up together with my 5 siblings in a town where people were all with the same religion, and we don't. And I know how feel the discrimination against. I know how it feels when you do not fit the expectations. And when I came here to United States, I knew that I had to learn English, and I felt the challenges and the suffering. But now I'm really thankful because all the experience that I have been facing in my life allow me to be more understandable with the people that we know and we work. I really appreciate the trust, and I really want nobody face discrimination, and I will always advocate with that. I really appreciate that in challenges times like this, there is one beautiful thing. The helpers show up. And I feel in this time, because yes, the time is challenged, but we have beautiful people who's gonna always show up and support the values, the mission that we have. And I just wanna say thank you for this.
Thank you so much. Very, very inspiring. So again, I'm Tim Trithart, CEO for Complete Health in the Black Hills, South Dakota, and the current treasurer extraordinaire for CHAMPS. Today, I am presenting the CHAMPS Outstanding Legislative Leadership Award, which is given to leaders in local, state, or national government at a public or private agency or within a health center or related organization who make significant efforts to advance community health policy. And it is my pleasure to present the 2025 CHAMPS Outstanding Legislative Leadership Award to one of my favorite people, Nadine Bowe, Chief Executive Officer at Northland Health Centers in North Dakota. Nadine's impactful work during the 2025 North Dakota legislative session highlights her exceptional commitment to advocating for community health centers and the patients they serve. Throughout the 2025 session, Nadine worked closely with Community Healthcare Association of the Dakotas, or CHAD, to write and deliver oral testimony on 3 separate occasions. She also supported Northland Health Center's leadership in providing testimony on key legislative priorities affecting health center funding. Beyond formal testimony, Nadine spent significant time at the North Dakota Capitol, building relationships with legislators and elevating the visibility of health centers among elected officials. She attended the 2025 CHAD Health Center Day at the Capitol, encouraged leadership staff from Northland to participate as well. She has been a vocal advocate among her peers about the importance of fostering relationships with elected officials, a practice she exemplifies in her role as CEO. Under Nadine's leadership, Northland was recognized on July 20th, 2025 by the National Association of Community Health Centers as a new advocacy center of excellence for prioritizing advocacy. Northland has actively engaged with members of Congress, their staff, and local elected officials. This past year, they hosted staff from U.S. Senator Kevin Cramer's office and from the office of former U.S. Representative Kelly Armstrong, who is now the governor of North Dakota, and have continued to consistently invite elected officials at all levels to their events. As Kim Coleman, External Affairs Manager at CHAD, remarked, Nadine's presence at the legislature and among elected officials has increased awareness of the health center mission at all levels of government in North Dakota. For her remarkable dedication to amplifying the mission and voice of community health centers, we are pleased to present Nadine Bowe with the CHAMPS Outstanding Legislative Leadership Award. Nadine, we'd love to hear from you.
Thank you so much. This is an incredible honor. You're one of my favorite people too, Tim, so thank you for that. This award means a lot, not because everything went perfectly this past year, but because the work we did started something important. Even though the bill to extend dental benefits for North Dakota's Medicaid population didn't pass, it opened the door to important conversations. People finally heard what it really means when someone in rural North Dakota can't get dental care, not because they don't want it, but because the system was never built with them in mind. I want to thank CHAD, our PCA, for nominating me and for encouraging me to take on this advocacy work. I'm grateful for the way they show up for us across the state. I also want to thank my team at Northland Health Centers, our staff, our providers, and our board. They are the reason I care so deeply about this. They're the ones sitting with the patients who are hurting or worried about how they're going to afford care. Their compassion fuels my advocacy every single day. Thank you, CHAMPS, for recognizing the effort it takes to educate, to advocate, and to keep important conversations moving forward. Change doesn't happen overnight, but it does happen when we show up together, consistently, in partnership, and with a genuine commitment to the people we serve. We'll keep showing up, keep advocating, and keep moving forward. Thank you again so much.
Congratulations, Nadine. This is John again. And in 2013, the CHAMPS Executive Committee created the Stanley J. Brasher Legacy Award in tribute to his service to the Community Health Center movement. Jerry Brasher was a founder of CHAMPS and other Community Health Center related organizations. He led Salute Family Health for 4 decades and represented the spirit of the Mountain Plain states through his dedication and service to urban and rural communities and commitment to provisions of accessibility, quality health care in Colorado and Region 8 and across the nation. I am honored to present the CHAMPS Stanley J. Brasher Award this year, which honors individuals who have dedicated their career to solving the problems of health, poverty, and human rights, and who have contributed towards the mission and recognition of community health centers in Mountain Plain states. It is my pleasure to present the 2025 CHAMPS Stanley J. Brasher Legacy Award to Jim Garcia, Chief Executive Officer and founder of Tapiac Community Health Centers in Colorado. So congratulations, Jim. Like Stanley J. Brasher, Jim Garcia hails from New Mexico and has made a lasting impact on Colorado. At 17 years old, he became the first of 11 kids in his family to leave New Mexico and attend college in Colorado. In 1993, Jim recognized a critical need for accessibility, affordable health care in his community. Just a year later, he launched Tapiac Community Health Center, first clinic out of a small neighborhood bungalow. He rallied community members to contribute their time, resources, and expertise, transforming the bungalow into a 2-exam room clinic. Today, Jim's steady and devoted leadership at Tapiac now operates a 24,000 square foot facility serving more than 10,000 patients annually. Jim speaks softly and carries a big, effective, and health care for all stick. Over the past 30 years, his humble and consistent leadership has shaped Tapiac into a trusted cornerstone of health and social justice in North Denver. Jim has embodiment of the Tapiac mission, which is to inspire health, well-being, humanity, and the community through all of life's stages. Beyond this work with Tapiac, Jim has contributed his leadership to numerous organizations serving as Colorado Community Health Center treasurer and as a board member of the Colorado Health Foundation, the Board of Environmental Health, Healthier Colorado, Mental Health Colorado, and the Mile High Health Alliance. Whenever there is an unmet need in the community, Jim steps in. He has offered Tapiac as a refugee screening site and partner with Grow Haas as a fresh food initiative. Jim also collaborated with the disability advocates to design a new Tapiac clinic site, recognizing the poor air quality in the area, formed a partnership with the Love My Air program. He continues to find innovative and impactful ways to serve and uplift his community. It is my pleasure to present this award to Jim Garcia.
Thank you, John, and good morning, everyone. I had the privilege of meeting Jerry Brasher during the latter part of his career at Salute Family Health. What I remember most about Jerry was that he was a great storyteller, and he had the ability to captivate an audience with stories that were sometimes slightly off color, but more often than not rooted in the basic principles of social justice. The simple belief that healthcare is an unalienable right, and that whether you are a migrant farm worker laboring in the field or an urban construction worker building a high-rise apartment building, you and your family deserved high-quality healthcare. As John mentioned, Jerry and I also shared something else in common. We both were born in New Mexico and both eventually made our way to Colorado to stake out our careers. What I learned more recently about Jerry was that while in New Mexico, he was elected to the state legislature. And while in the state legislature, he co-sponsored a bill that led to the creation of the University of New Mexico Medical School. Now, if that wasn't interesting enough, about 10 years after the UNM Medical School opened its doors, my older sister, Cecilia, was accepted as a first-year medical student who eventually went went on to serve at an FQAC serving a rural part of Albuquerque. I only regret that I wasn't able to share that part of the story with Jerry and the ripple effect of his life's work. So when I think about leaders like Jerry Brasher, and when I think about the current leaders in our community health center movement, I am filled with hope and the belief that even during these challenging times, we will continue to persevere, we will continue to innovate, and we will continue to find ways to build healthy communities. Thank you to all my friends at CHAMPS, and thank you to my team at Tepeyac Community Health Center for this incredible honor.
Thank you, Jim, and sincere congratulations again to all 2025 CHAMPS awardees. And thank you all for joining us today. We're so pleased you were able to celebrate with us. And in further celebration of CHAMPS awardees, please visit the CHAMPS Awards webpage where you can find more information about these amazing, inspiring folks and about awardees from prior years. Please click on the link in the chat box to explore the CHAMPS Awards webpage. The call for nominations for 2026 CHAMPS Awards will open this summer, and we encourage you to be considering which of your stellar peers and colleagues you'd like to nominate. It is an honor to serve you as the Region 8 Primary Care Association. Your efforts to care for and ensure the well-being of your communities, patients, staff members, and organizations are incomparable.